Welcome to the third training in the Environmental Health series created by APPLETREE, Dartmouth Geisel School of Medicine, and the Dartmouth Health Cancer Center. My name is Megan Romano, and I am an Associate Professor of Epidemiology at Dartmouth's Geisel School of Medicine. My primary areas of expertise are environmental health and perinatal epidemiology, and I'm delighted to be talking with you today to lead this approximately 30-minute training on understanding environmental contamination and risk. After completing today's training session, you should be able to define environmental contamination, describe how exposure to environmental contamination may lead to adverse health outcomes, differentiate between naturally occurring and human-made environmental contaminants, consider strategies for risk communication, and identify resources for addressing questions about environmental contaminants of concern. To begin our training today, we will start by answering the question, what is contamination? Contamination occurs when a substance that does not belong is present in the environment. Contamination is of particular concern when it's present at levels that have the potential to influence human health. Contamination can take on several forms and may be chemical, microbial, or radiological in nature. Contamination in your community may present public health risks, and that can be complicated depending on its source. In some cases, contamination or the perception of contamination can be a source of significant public concerns. Regardless of the perception, local leaders can benefit from having a basic understanding of what contamination is and how to respond to public concerns. Although we tend to think of contamination as a result of human activity, it's important to remember that contamination can also occur naturally. We'll discuss this more later in the training. Environmental health is a specialized branch of public health and refers to the relationship between the natural, built, or social environment and the health of people and communities within that environment. The environment includes the air we breathe, water we drink, and the land where we build our homes or engage in recreational activities. When thinking about an individual's exposure to contaminants in the environment, we need to consider all possible routes of exposure. The three primary routes of exposure are inhalation, what we breathe in, ingestion, what we eat or drink, and skin or eye contact. We may inhale contaminants from indoor or outdoor air. When showering, some types of contamination in our water can become airborne, also leading to exposure through inhalation. We may ingest contaminants when they are present in the food or water that we eat and drink. Finally, our skin and eyes may absorb certain contaminants, for example, when we are bathing or swimming, or as we handle certain materials. Your total exposure is the combination of all contaminants absorbed through inhalation, ingestion, and skin or eye contact combined. This varies between individuals and across communities. The risks to our health from contamination are related to both our own underlying health and the degree or severity of the contamination. Broadly speaking, we consider risk as the possibility of injury, harm, or other unwanted negative consequences. The severity of any risk may be known or unknown, but understanding how likely you or your community are to experience negative consequences may help in making decisions about how to respond to risk. Imperfect or incomplete information often contributes to uncertainty about risk, and this is further complicated when risks are complex. High levels of exposure to environmental contamination or exposures to individuals who are particularly vulnerable, for example, pregnant individuals or children, may carry substantial risk. When too much contamination is present, there's risk to public health. On the other hand, healthy individuals may exhibit resilience, allowing them to tolerate low levels of exposure to environmental contamination without harm, or with a quick restoration of health following exposure. The degree to which contamination leads to adverse health outcomes is influenced by the type of contaminant, sensitivity of individuals or populations exposed to the contaminant, and the type of health effect that may occur. The level of risk will also inform the need to prioritize exposure reduction measures. As I mentioned earlier, contamination can be either naturally occurring or it may come from human activities. Let's focus first on naturally occurring contamination. Some contaminants in our environment are not human-made, but occur in nature. Some examples that you might hear about from New Hampshire residents include arsenic in private wells, radon in homes, air pollution from wildfire smoke, harmful algae blooms in local lakes. This naturally occurring contamination can pose a threat to human health and must be carefully monitored. The source of naturally occurring contamination can be hard to identify since it relates to natural features of the environment around us. Due to the geology of New Hampshire and surrounding regions, naturally occurring contaminants are especially common, including in private well water. These contaminants often have no taste, smell, or telltale visual signs of their presence, which means that we usually need to test for natural contaminants in order to know they are in well water. Chronic exposure, that is, repeated exposure to even small amounts of contamination over a long period of time, increases the risk of health consequences. The limited regulatory requirements for private well owners also increases the risk of contamination and risk to health, given that residents infrequently test their well water because they are not mandated to do so, whereas public water systems test for contamination frequently by law. Next, we will consider human-made contamination, or contamination that is due to human activities rather than being naturally occurring. Often human-made contamination is caused by improper handling of chemicals or waste. It may be hidden or unidentified in some cases. Common causes of human-made contamination include former spill sites, industrial operations, mismanaged landfills, gas stations, and Superfund sites. We will describe Superfund sites in more detail later in the training. One of the reasons why human-made contamination has received so much attention in recent years is that since the mid-1940s, chemical production has increased nearly 20-fold, making more chemicals common in our daily lives. The U.S. Environmental Protection Agency keeps a list of all chemicals manufactured or processed in the United States. And there are currently about 80,000 chemicals registered for use in commerce in the United States. Among these, more than 25,000 pounds, or about 7,000 chemicals, are manufactured or imported to the United States each year. Only about 200 of these chemicals have been rigorously tested for health effects, and nearly 700 new chemicals are expected to enter the market each year. Because most chemicals are not tested for safety before entering the market, this makes for a very challenging landscape when considering potential implications of human-made chemicals on population health. There are a growing number of recognized human-made contaminants. For example, the per- and polyfluoroalkyl substances have been widely used in industry and consumer products for almost 70 years. They are incredibly persistent in the environment. These chemicals have a wide range of applications in industry and are present in a wide range of consumer products, including nonstick cookware, food packaging, water and stain-resistant fabrics and textiles, and cleaning products. Other synthetic chemicals that you may hear about from residents of New Hampshire include 1,4-dioxane, which has been used as a stabilizer for chlorinated solvents and can be found in detergents and personal care products, or trichloroethylene, another chlorinated chemical used in consumer cleaning products and automotive coatings. It is important to acknowledge that both human-made and natural contamination carry health risks. For example, industrial air pollution and smoke from wildfires may carry similar risks for health. In protecting human health, we want to be mindful of both human-made and naturally occurring contamination, as both are critical, though communities often perceive a greater risk associated with human-made contamination. Let's consider a few examples of risk identification and possible reduction measures related to our home environment. Our first question is, has your home been tested for radon? Because radon is a leading cause of lung cancer and is also common in New Hampshire, we may wish to consider whether we are exposed to radon in our homes. In order to reduce the risk of lung cancer from radon exposure, we might first test our home for radon and then install a mitigation system if radon is present at levels of concern. A second question related to environmental contamination that we might ask is, does your home water come from a well? Almost half of the population in New Hampshire uses well water in their homes, and contaminants such as arsenic may be present in well water. Again, we may test the water and consider home water filtration or other measures to help reduce exposure to contaminants in well water. A final example is, has your home been tested for lead? Lead is unfortunately a common contaminant throughout New England, and exposure is associated with neurological and brain damage. Testing homes, particularly those built before 1978 for lead, is prudent, especially if children or pregnant women are living in the home. Preventing lead paint from chipping through maintenance can drastically reduce lead contamination within the home. Superfund is the name given to the law called the Comprehensive Environmental Response, Compensation, and Liability Act of 1980, or CERCLA. Superfund is also a large trust fund created by Congress and administered by the Environmental Protection Agency. It is used to handle emergency and hazardous waste sites that require long-term cleanup efforts. These are referred to as Superfund sites. EPA's Superfund program is responsible for cleaning contaminated land, responding to environmental emergencies, oil spills, and natural disasters. There are 22 Superfund sites in New Hampshire that are managed through partnership between the US EPA and New Hampshire Department of Environmental Services. Now that you've learned a bit about environmental contamination, we're going to switch gears to talk about risk communication strategies. Individuals think about risk in different ways. This is informed by their own health, the health of their communities, and the people around them. Tolerance for risk varies considerably across individuals. Because individuals within a community may feel differently about risks based on their health, backgrounds, and circumstances, among many other complex factors, risk communication is a critical tool that regulators and public health agencies use to help communities make decisions to reduce their exposure to harmful chemicals or situations that could harm people. I don't expect you to become an expert in risk communication today, but I do want to raise your awareness about risk communication. Successful risk communication will account for differences in preferred communication approaches and risk perception. Which seems riskier? Swimming with sharks or riding a bicycle? Would you be surprised to learn that over a 20-year period in the United States, only 14 people were killed by shark bites, whereas more than 15,000 people were killed in bicycle-related accidents? As it turns out, sharks are not particularly interested in hurting humans, but people die in traffic-related accidents every day. This illustrates how actual risks may not align with people's perceptions of the risk from these scenarios. To communicate risk effectively, you need to consider people's perceptions. An interplay among a number of complex factors will influence perception of risk for individuals and communities. Here we highlight some factors that frequently lead to a perceived risk that under or overestimates true risk. For example, naturally occurring contaminants are often perceived to be less risky than human-made contaminants, though some naturally occurring contaminants are equally or even more dangerous than some human-made chemicals. Often chemicals that cause rare or dreaded diseases, such as cancer, are automatically perceived to be more risky than chemicals causing common chronic conditions such as heart disease. The implication of the conditions perceived as less risky may still be quite severe. When the effects of a chemical are unknown, they are often perceived to be more risky than for chemicals when the associated risks are well understood. However, unknown risks may subsequently turn out to be mild after we learn more about a chemical. When exposure reduction measures are within an individual's control, like testing the air or water in your home, risk is typically perceived to be less than when an individual cannot control their own exposure, like when an oil spill occurs. However, this can lead to complacency with unnecessary exposures that may carry substantial risk. Finally, media attention can also have a substantial impact on perceived risk. National headlines from multiple news outlets will increase perceived risk even if the actual risk is low. Remember our example about shark attacks? Media attention surrounding isolated and rare incidents where shark bite fatalities occur lead to a public perception that swimming is very risky due to possible shark attack, when this remains a truly rare event. So to highlight all of these factors, we can consider the example of arsenic. Even though arsenic is known to cause cancer, perceived risk of arsenic exposure is often underestimated for several reasons. First, because it is naturally occurring and can't be seen, tasted, or smelled in contaminated water, it is incorrectly considered to be harmless. Second, because it does not make you sick immediately, and exposure is often within control of the individual, it has a low perceived risk, despite the actual risk of adverse health consequences following exposure being potentially very high. For example, chronic exposure to arsenic carries an increased risk of bladder and skin cancers. Understanding that different individuals and communities may have different levels of perceived risk highlights the need to understand where you are in terms of perceived risk in your community. You need to read the room and align your resources, knowledge, and expertise to meet risk communication needs based on the perceived risk. For example, a community may face an exposure that is high risk, but have little information or concern for that risk. Communication around this typically will require close collaboration and cooperation with community members and other partners to find ways to educate the public and bring their attention to the relevant threat to their health. Risk communication is a balancing act. Your messaging needs to address the actual hazard of the situation, but also be aware that risk perceptions in your community will influence your messages. If you mismatch your communication style with a situation, you can lose the trust of an affected community and create challenges for addressing the problem in the future. Once you understand a community's perception of risk, these are some tips for effective risk communication. First, active listening is critical for facilitating two-way communication. Next, repeat and reshare community stories and concerns. Clarify what has been shared with you to be sure that you truly understand the needs of your community and that you are sharing their perspectives accurately. Recommending simple, achievable steps to reduce exposure in the community is very important. If you don't know what those steps are, share your limitations and contact state, federal, or academic partners for technical support. Finally, develop 3 key messages that include 1. What is known and unknown. 2. Sharing of contacts and resources. 3. Identifying and describing the next steps for the community. Several things can make risk communication more challenging, and identifying these challenges and crafting a risk communication strategy with them in mind is very helpful. It is important to be aware of the diversity of perspectives and experiences within your community. Understanding the perception of risk among community members and subject matter experts, especially if these perceptions are very different, is key to crafting a strong risk communication strategy. Ideally, you will have built up trust among community members, government officials, and subject matter experts long before a crisis occurs. But the need for this trust cannot be neglected. Technical language and jargon can make it challenging to engage with audiences that have different risk perceptions and levels of understanding of the present challenge. Regulations and scientific research evolve, sometimes rapidly, and sometimes very slowly. And this can be a surprise to community members and the general public, making it more difficult to translate risk for a wide range of audiences. Finally, the limitations of environmental sampling and analytical methods can be difficult to accept and work with. Keeping these challenges in mind at the forefront of crafting a risk communication strategy is key to successful community engagement. The great news is that you have many resources available to you to help with navigating these challenges when they arise. These include a wide array of community, state, federal, and other resources that work together. One resource available in New Hampshire is the APPLETREE Program that works to help communities reduce exposures to environmental hazards. They work within the state's agencies to build partnerships with stakeholders across New Hampshire communities. Please also be aware that there are partners at local, state, and national levels who are prepared to connect you with the resources and technical support that you need when you have questions about environmental contamination in your community. Academic partners in our region are also helpful allies and are able and willing to provide support and advice as you tackle environmental contamination in your community. A helpful resource guide was recently developed to help connect you with the resources that you need. This can be accessed from the New Hampshire DES website, and a separate recorded training is available to introduce you to the guide and help you get started. You are probably already familiar with the wide range of questions that communities may pose related to contamination concerns. Questions about the water we drink, air we breathe, and food we eat are common, as well as concerns about waste disposal and industrial activities. Now we will walk through a couple of examples and highlight the resources that are available to help you address community contamination concerns. A community member reaches out to share that there is a strange smell emanating from a nearby factory. Your next step would be to contact the Air Resources Division at New Hampshire DES, which is a state agency that regulates emissions from permitted operations and tracks air quality in our state. Other concerns that you might refer to the Air Resources Division include questions about fumes or vapors from chemicals, factory permits and emissions, concerns about wildfire smoke. In another situation you may encounter, a community member reaches out to express concern after becoming aware of contaminants in their drinking water at home. Your next step would be to contact the Water Division at New Hampshire DES, which is a state agency that manages, protects, and regulates water quality in the state. Other issues that you might refer to the Water Division at New Hampshire DES include observations about unusual appearance, taste, or smell of water, concerns about the possible presence of lead pipes to supply water, questions about surface water safety, including rivers, lakes, dams, and stormwater, inquiries about recreational water activities such as swimming. One final example relates to concerns about local landfill or waste disposal activities that may lead to pollution. Your next step would be to contact the Waste Management Division at New Hampshire DES, which is a state agency that manages and regulates waste as well as overseeing remediation of contaminated sites in our state. Other issues that you might refer to the Waste Management Division at New Hampshire DES include observed or suspected illegal disposal of oil or hazardous materials or dumping of solid waste, roadside spills related to vehicular accidents, any general concerns about chemicals or other waste. Let's wrap up by reviewing some of the most powerful health protective actions you can employ to protect the health and well-being of your community. Almost half of New Hampshire residents get their drinking water from private wells, so promoting testing of private wells has wide-reaching health benefits for preventing exposure to contaminated drinking water. The New Hampshire DES has detailed information about private well testing that you may find useful to review. Keep an open line of communication between yourself, your community members, and your community's health officer. Actively engaging with residents is a great way to keep on top of community concerns. Use the Community Stress Resources Center developed by the Agency for Toxic Substances and Disease Registry. The experience of environmental contamination can have long-lasting contributions to psychological and social stress among affected community members. This tool will help you strategize actions that you can take to support your community in times of stress related to environmental contamination. We also welcome your feedback on what types of tools we could create in the future to support you and your community. In fact, this training was requested by a group of community stakeholders, and we look forward to continuing to provide you with the support and resources that you find most helpful. To recap, during today's training, we defined environmental contamination, described how exposure to environmental contamination may lead to adverse health outcomes. We learned to differentiate between naturally occurring and human-made environmental contaminants. We also covered important points of consideration for risk communication strategies. And finally, we identified important resources that are available to you to assist you in addressing questions about environmental contamination concerns. To close, I will leave you with the contact information for Dr. Robert Thistle at APPLETREE and say thank you to the team spanning APPLETREE, New Hampshire DES, New Hampshire DHHS, and Dartmouth for their contributions to today's training. In particular, I'd like to thank Dr. Jonathan Patali, Lori Reardon, and Maisie Leibowitz for their contributions to this training. I hope you found the training informative, and we look forward to your questions and suggestions for future trainings.